Hi friends, I am Dr Swapna Chekuri from Hyderabad Women and Fertility Center. Welcome to my channel. So today we are going to discuss about what's the correct age for IVF, because so many individuals they do ask what's the ideal age when we have to go for IVF, can we wait for another 2 or 3 years more. So all these queries have been asked, so we are going to discuss in detail. So according to me, ideal age for planning pregnancy would be 24 to 30, because before 24 the lady wouldn't have been mentally prepared or mentally mature enough to take care of the baby, and after 30 again the ovarian reserve comes down. So ideal age would be 24 to 30, and after 35, more than 35 if you plan, what happens again, the chance of genetic syndromes and the chances of mother developing hypertension, diabetes and other medical related issues will be more. So that's the ideal that's the reason we usually ask the couple to plan before, in between 24 to 30 years, and they should finish the family before 35. And coming to this thing, we need to understand the physiology of ovulation. So when the girl baby is in the mother's womb, that's when the number of oocytes will be fixed. At birth the number of oocytes will be maximum, and at puberty, once they attain menarche, with every month usually one egg develops into a dominant follicle and that will ovulate. Along with that, the rest of the 2-3 follicles will also grow, but they won't grow to the maturity size. So those 2 to 3 follicles will be wasted every cycle. So this is the importance of planning for pregnancy as early as possible, because what happens with every cycle, one dominant follicle will be released, one egg will be released. Along with that, the rest of the 4 to 5 follicles, whichever is coming up, that goes waste. So as the age increases, the ovarian reserve also goes down, and so many individuals they do ask, are there any medication to improve the ovarian reserve? See, basically whatever the medications we give in ladies with poor responders or with low AMH levels, these medications they help for the smaller follicles to grow, but as such they cannot improve the reserve as such. And same thing with the male partner, even with in the husband side, as the age increases, even the sperm quality and motility, morphology also will be lowered definitely, and then DNA fragmentation index also will be altered. So it's always preferable to plan when in the younger age group, and avoid smoking and alcohol, because these two can affect your sperm quality as well. And usually in some gents, male partners, we usually see the semen analysis as azoospermic. So in those individuals the sperms will be produced, but they may not be able to come out through the ejaculate. So in those cases we usually advise for IVF through TISA or PISA. So in these two procedures the sperms will be retrieved, and those sperms will be using for IVF or ICSI. Okay, and the individuals with a very low semen count or very poor morphology also we usually advise for ICSI instead of IVF. And among ladies, if the bilateral tubes are blocked, even though they are younger age group, if the tubes are blocked, or in cases of severe endometriosis, or in cases where their AMH levels are very very low, or in case of poor response, and in case of unexplained infertility also, we usually ask the couple to go for IVF. So there is no fixed age there is no fixed age to go for IVF. Depending on your problems, depending on your reserve, and depending on the husband factor, you need to take a decision whether to go for IVF or whether you want to plan with the smaller methods. And definitely a doctor is there to guide you. So when the couple comes, we usually evaluate both male and female partner and we give a decision. So friends, if you like this video and if you feel it's informative, please like my video and subscribe to my channel and share with your friends and family members and to the needy people. Thank you.